refer to my cheat list, incorporate the and there seems to have been saying that last time I was here I didn't do the pro. That's not true. Definitely did the pro. But no problem. It's not problem. It was pro, I did supine, pro and sideline.
There was like an oscillation you made.
Yeah. And cross hand traction and so on.
Yeah,
But I'll go over it. It's fine. I'll go. But also there was sideline. And I'm pretty sure I did some sitting techniques. So, let's go back to what we're doing. How do we incorporate this into our treatment and examination? And there's some patterns. So, I tell you, I just think, sometimes you get asked questions. Well, I get asked, are there any questions you could ask the students? I get asked, are there any questions that the students could be asked?
Či sú nejaké otázky, ktoré by mohli byť,
I get asked by the faculty, are there questions that
like on the exams.
Okay.
Či sú proste nejaké otázky, ktoré sa vás môžu pýtať.
It's probably a good idea to remember in the swing phase,
možno je fajn sa zapamätať, že
which the muscles are initiated
že počas tej švihovej fázy, aké svaly iniciujú ten pohyb.
for the swing, and which muscles are involved in deceleration.
A aké svaly potom sa podielajú na tej decelerácii, na tom brzdení.
Acceleration, deceleration. That's a good one, isn't it?
Takže to by mohla byť dobrá otázka.
Which muscles? And okay, and maybe even just remembering heel strike, flat foot, as heel strike, flat foot, mid stance, toe off.
A možno by bolo fajn aj poznať tie jednotlivé fázy, tej stojnej fázy.
Or even more simplistic questions like, what are the two major components? Swing phase and stance, stance phase and swing phase.
Ešte možno dobrá, taká veľmi jednoduchá otázka by mohla byť, že na aké dve fázy sa dá rozdeliť ten chôdzový cyklus, čiže na tú stojnú a tú švihovú.
If you can remember more technical, which levels are involved with, say, foot drop.
Že možno bolo fajn vedieť aj, že aké svaly môžu byť oslabené pri poklesnutí toho prdla.
Or a gluteus medius lurch.
Alebo pri poklese pánvy, oslabení kultúru medzi.
They're good ones to remember.
Že aj toto bolo fajn vedieť.
I can't guarantee what will be asked.
Neviem vám garantovať, čo sa vás budú pýtať.
But they're good things to remember. So, if we come back to, if I have a patient, anyone, quickly. So, let's imagine we're hypothesizing. So we hypothesize that this person has come in with hip pain or knee pain. Or hip and knee pain. Hip and knee pain. Hip pain and knee pain. Okay? So she's come to see with left hip pain, knee pain as well, and knee pain.
Táto osoba prichádza s bolesťou ľavého bedra.
So she comes in, I've watched her walk in.
Pozriem si ju
I've already watched her on the phone. Okay. So we will go through the case history, which we're not going to do.
Samozrejme, by ste si odobrali anamnézu.
So the first thing I would say is, okay, taking all the history, right, what, can you just walk up forward and back for me,
A
please?
potom odobranie anamnézy, že som poprosil túto osobu, aby sa poprechádzala.
And just do it a couple of times, walk up and down.
A potom párkrát tak za sebou.
Čiže to víno zo včera.
To som chcel povedať. Okay, so I make a quick observation. Turn face me. Okay. And then I look under here to the arches of the feet.
Pozriem sa na
We're not going to
levy.
make a diagnosis now, I'm just trying
Ešte
to make
nerobím diagnostiku, ale dám diagnózu.
check the knees.
Pozriem si kolena.
Is there any hyperextension?
Sledujem, či je tam nejaká hyperextenzia
How is she
kolena.
standing? Looks reasonably comfortable. Then I come now, so I'm just, because, oh actually she's come in with it. So I'm just going to have a quick look at on the back here at your
Pozriem
pelvis.
aj na chrbát, na pán.
And I check, okay.
Pozriem
And
si.
So I go iliac crests,
Idem na pán, na
PSISs,
na posteriorné spiny.
and I would ask her, step forward with the right leg please.
Pôjde kľúčik pravou nohou.
Come back again,
Práca na
step
stred.
forward with the left leg.
Pôjde ľavou nohou.
Come back again. Keeping both feet flat on the floor.
Nechávaš nohy na zemi.
Just bend your right knee, please.
Pravé kolno.
Back up again.
Práca na stred.
Bend your left knee.
Ľavé kolno.
Back up again.
Vrátime sa.
So initially I'm looking at that lower triangle.
Takže teraz sa pozriem na ten dolný trojuholník.
How does that translate up into here?
Pozriem sa, ako sa ten pohyb prenáša
Stop the right
do
knee
tej
again.
štvorky.
Back up again. Left knee. Back up again. Okay. Just have a quick look. Now what we were talking about yesterday with, so the head's coming back, slowly the head's starting to come back. Is the occiput roughly over T4?
Už včera sme sledovali, že či ten occiput je niekde nad TH4.
Not really.
Nie úplne.
Okay. So there's something else going on here.
Takže niečo ďalšie sa bude diať tu.
Take a deep breath in
Poď sa hlboko nadýchnuť
and out.
a vydýchnuť.
Take a deep breath in
Znova sa hlboko
and
nadýchnuť.
out. Just bring your arms up to the side. Hold them there for me. Stop me pushing down.
Zastav ma v tom
You push
tlačku.
down. You
Zatlač
okay?
dole.
Drop down. Stop me pushing down.
Zastav ma v tlačení. Teraz ty zatlač
Relax.
dole.
Just relax. Let your arms drop to there. Just put your chin to your chest.
Daj bradu k hrudníku.
Back up again.
Znova zdvihni.
Look up to the ceiling.
Pozri sa hore k stropu.
Back up again.
Vrát sa na
Any
strop.
pain on any of those movements?
Nejaká bolesť pri týchto pohyboch?
Yeah. So, and she's already being held forward with her head. That's why I checked here to see what's going on.
A už vlastne predtým bola predklonená hlava trošku dopredu, preto sa zamerala na túto oblasť.
Basically, first ribs appear to be raised, more on the left than the right.
Plus to prvé rebro vľavo sa javí vyššie.
Don't forget she's coming with hip pain.
Ale nezabudajme, že prichádza z bolesťou bedra.
So, yeah, you come with, look over your right shoulder, please.
Pozri sa na pravú rameno,
Back to the front.
vrát sa naspäť.
Look over your left shoulder.
Pozri sa teraz cez svoje ľavé rameno.
So, then I might ask a few more questions. I've already done the case history. So, with your work, are you sitting for long periods on the computer?
Pracuješ dlho za počítačom,
So, leading us more into like the upper cross syndrome, maybe?
že zistujem, či ma niečo narazí treba z horného
Come back
strížneho
to
syndromu.
So, she come in with hip pain. I said, okay, so I'm hypothesizing this isn't true.
Vytváram hypotézu, ale to nie je pravda.
So, when I asked you to step forward,
Keď som ťa vyzval, aby si neprešiel dopredu,
you had movement that way.
mal si pohyb
I'm making
napravo,
this up.
teraz som to vymýšľam.
Yeah, this is not real. So, you had movement that way.
Čiže mal si pohyb do tohto smeru,
You didn't get movement.
ale nie
What I'm saying is, here at the base,
čiže
you have a
preklade
triangular bone, the sacrum. And
na
when you step forward, it should move one way. You step forward the other way, it
Čiže
should
máš
move.
tam nejakú krížovú kosť, ktorá by sa mala ukláňať
You get
jedným
movement one way,
smerom.
not the other way.
Do jedného smeru ti to išlo, do druhého nie.
When I asked you to drop your knee,
Keď som ťa poprosila, aby si
I'm looking for-
popršla koleno,
a curve with an apex roughly here.
tak hľadám nejaké zakrivenia
Well, it isn't
okolo
really
krivky
happening.
v tejto oblasti, ale to
Probably
sa
what's
tam
going on here.
veľmi nedialo.
And that's translating up here, making this struggle. But you already are like this.
A
This
už,
bit's good.
aha,
And
už teraz si v takomto postavení,
this rib is raised.
toto rebro je vľavo je
Because these muscles,
vyvýšené, pretože tieto svaly
they're secondary muscles of respiration,
sú druhotné svaly pre
scalene,
dýchanie,
sternocleidomastoid. They help elevate your rib cage
pomáhajú nadvihnúť tvoj hrudný kôš,
if they're needed.
ak sú
Primary
potrebné.
muscle is the diaphragm.
Pretože primárny sval je tá
If
brajnica,
that's struggling or
ak
you
tá má
have
problém,
you have to bring in these.
tak
Sometimes sitting,
potrebuješ si pomôcť tým pomocným.
tighten these muscles, but it's also bringing your head forward.
A to sedenie za tým počítačom
So
vyváži
yes,
tú hlavu
you've come in to see me with the hip, and I could really hypothesize. I think part of your problem with your hip is your foot.
Myslím si, že
Maybe
časť
doing
problému
this.
s tvojim bedrom
It isn't.
bude problém v svojom chodidle,
Your foot may be doing that, which is affecting your knee,
pretože tvoje chodidlo
which is
prepadáva
possibly
dnu,
giving you hip pain.
to ovplyvňuje nastavenie
So there's a
kolena
whole body thing.
a bedra.
Probably down the
Takže
back.
problém celého tela. Vysielame na chrbát.
At that stage, I said, "You okay? Was there any questions with that? You all
V
right?"
poriadku, alebo máme ďalší štádium bude
There are some problems with the ankle.
asi tu aj bude nejaký problém s ankle.
So, what I'm going to do today, you came in to see me with hip pain and some knee pain,
Prichádzaš s bolesťou
and
bedra
I'm
a
going to work around the
kolena,
whole body.
ale ja si pozriem, preskanujem celé telo.
And it may be that because of what's going on with your neck and shoulder, that may be contributing as well.
A musíme tam nájsť nejaké
Because of
problémy
the way
v
you're
tom
standing.
krku a v tom ramene, tak to môže ovplyvňovať, môže to mať nejakú súvislosť s tými ďalšími komponentami.
How's your cat?
Ako sa môže mačka?
Hungry all the time.
Stále hladná.
Hungry all the time.
Že z Maďarska, to znamená.
So, we carry on as if we were doing the normal GOT,
Postupujeme, ako by sme robili GOT,
but specifically we started talking about the foot and ankle, and I want to show you how to incorporate that in.
ale špecificky sme sa bavili o členku a o chodidle a členku a ako to zakomponovať.
The knee, it was the other knee that she was complaining of,
Potom sa sťažovala na
not this one, but
koleno,
I still
na druhej strane,
check what's going on with this knee,
ale aj tak potrebujem pozrieť na to, čo sa deje s tým kolenom.
come around and check the other knee. This is the one that was the, ooh,
Čo to bolo problematické koleno.
a bit more medial collateral ligament laxity on this side.
Trošku je tu väčšia laxicita mediálneho a kolaterálneho ligamenta.
Any problem?
Any problem?
Yeah.
Like real?
No. You're the patient now. You're the fake patient.
Okay.
So that was the one, I've compared it with that one.
Porovnávam si jedno s
Move
druhým.
down to the ankle.
Idem na spodnú článku.
Okay. So we'll imagine it's the other one that's got the problem, the other ankle, along with the knee and the hip.
Čiže predstavme si, že pracujeme. So we should imagine that we are.
This ankle is the problem, not this one.
Okay, čiže
That hip has a problem, that knee has a problem, so I'm imagining.
vieme, že na tejto strane máme problém na tej ľavej strane, bedro a koleno.
So this one I may not spend too long on.
Čiže na tomto nebudem
No, in reality,
až
this
tak
one has a
dlho.
problem.
Ale v skutočnosti táto strana je horšia.
So we'll have to come back to that.
Čiže tam sa mám musieť vrátiť.
So some of the techniques that we're incorporating yesterday,
Takže nejaké z tých techník, čo sme robili včera,
in reality, remember we were talking about Henry's lines?
a bavili sme sa o tých Henryho líniách.
This could be a classic example where
Toto môže byť klasický prípad,
I know we've just made up the scenario, but the hip could be affecting
tú situáciu,
the shoulder.
To rameno môže ovplyvňovať protilahle, to bedro môže ovplyvňovať protilahle rameno, alebo naopak.
Okay.
It's a good wellness. I was on a wedding yesterday, so.
Wasn't in my hotel, was it?
No.
There was a wedding in my hotel last night. Okay. Just going to put pressure there. You all right? Push out towards me.
Zatlač
Yeah.
proti nemu.
Relax. Push again.
Tlač.
Relax. And push again.
A znova.
Relax.
Tuto mi tlačí.
Do
No, že
toho
vie.
trapezu.
There are where's the point?
It's a trigger point you can find almost always in people. You can find a trigger point in trapezius or supraspinatus.
Okay, typically they're talking it's like a muscle or like a rib or something like that.
And almost every one of us in here,
A
But-
skoro každý...
but patients think you're amazing. You go, and they go, oh, you found it. Oh, it's so good. And all of us
Pacienti si
will
myslia, že ste
have
úžasní, že ste to našli.
problem there.
Ako sa vám to podarilo?
But having said that, that's not to dismiss it because that actually was tight. And also, if you're using, it's not really that surprising.
Nie je to až tak
Because
prekvapivé,
there is this element going on
pretože
with the
tam máme
shoulders.
tento element.
And for an awful lot of us, it's life.
Je to život.
Oh no, it's not.
So this is the side that I was more concerned with, or hypothetically.
A skôr teda tá strana, ktorú sme si hypoteticky zvolili ako problematickú.
Okay. Push your ankle that way.
Zatlač tým členkom do toho smeru.
Right. Push again that way.
Znova zatlač proti nemu.
And push again
A
that
ešte
way.
jedenkrát zatlač.
Right. You okay? Pull your heel back to your buttocks.
Pritiahni petu k zadku.
So I'm incorporating some of the techniques we were doing.
Opäť využívame niečo z toho, čo sme robili včera.
Relax. Pull back again.
Znova pritiahni.
Relax.
Uvoľni.
Pull back again.
Pritiahni.
Relax. Straighten your leg.
Vystri nohu.
Relax.
Uvoľni.
And again, straighten your legs. Relax. And straighten your legs. Relax.
A uvoľni.
Okay. Just push up towards the ceiling.
Zatlač proti stropu.
Relax.
Uvoľni.
Push up again.
Zatlač.
Relax.
Uvoľni.
And push up again.
A zatlač.
Relax. I noticed last night
Včera som si všimol,
when we were doing some of these techniques
že keď sme robili niektoré z týchto techník,
that this one in particular,
hlavne táto technika,
some of you were on the wrong side.
niektorí ste boli na nesprávnej strane.
I had to move to this side because I don't want her to lift that hip.
Kontralaterálne, aby
Push
ste
your
si
knee
mohli
that way.
zafixovať to bedro, s ktorým pracujete. Ty zatlač proti ňom.
Relax.
Uvoľni.
Push again that way.
Znovu zatlač.
Relax.
A uvoľni.
Just to lift it. You don't have to do all these techniques.
Môžete si robiť všetky z
Obviously.
techník.
Stop me pushing that way.
Zatlač ma v tlačení
I'm just kind of going over some of the things we were doing yesterday.
a
Relax.
je to len
Your
rekapitulácia toho, čo sme robili včera.
For your benefit. Stop me pushing that way. Relax. Oh, that ankle does creak as well. What are you doing with your ankles?
Čo robíš s tvojimi článkami?
Už mi povedali, že aký by som tam mala baliky lenty, jak tých článkov.
She was told that it is as she had what's it was about
Smarties.
in her ankles.
Smarties.
Podľa mňa
Ty nie sú až tak chumkavé.
So you kind of use, like I said, some of the orthopedic testing you can use as actual articulation.
A ako som hovoril, niektoré z vašich testov, ktoré poznáte, môžete využiť ako mobilizáciu.
So it was neutral, compression,
Kompresia,
distraction,
distrakcia,
flexion with distraction,
flexia, distrakcia,
compression.
kompresia.
You okay? Check the movement of the fibula.
Pozrieme sa na pohyb fibuly.
Encourage it if you don't think it's a move a bit easy.
Podporíme ten pohyb, ak máme pocit, že niekam nejde.
Move down to the ankle.
Posunieme sa k článku.
You okay? Let me know if you're problem.
Povedz, keď máme problém.
Turn your foot out that way, please.
Vydrž nohu smerom von.
Relax.
Von.
Turn your foot out.
Opäť vydrž nohu smerom von.
Relax.
Von.
Turn your foot out.
Vydrž nohu.
Relax.
Von.
Turn your foot in.
Zatlač nohu dnu.
Relax.
Von.
Turn your foot in.
Zase zatlač nohu dnu.
Does this help doing it this way, showing you the treatment or not?
Je vám to fajn, keď to opakujeme, alebo nie?
Áno, áno.
Okay, just checking. Push down towards me. Relax. Push down. Relax. Push. Relax. Obviously, if there was plantar fasciitis,
Ak by tam bola nejaká plantárna fascitída,
the point of attachment of the plantar fascia on the inferior medial tubercle of the calcaneus
tak ten úbon na ten inferiorný
It's good to do like trying to break the fibers down.
K tuberku by sme chceli vlastne len trošku prejsť manuálne.
Okay. Okay, and then look. That was all. Sure, okay.
Yeah, the cracking is painful.
Okay. It's not me actually cracking, it's her ankles.
Yeah, yeah.
Ten článok sám o sebe chlúpka. Puká.
You have to look, don't you? You're right. So, we knew that the first rib on this side,
Viem, že prvé rebro na tejto strane bol vyššie.
okay?
Jak se
If you could describe how can you tell if the first rib is
Yeah, okay. Simply put your hand on it, you get a feeling that you can feel the rib,
Viete na palpovať to rebro.
and if they're, I mean, this looks high because it's a skeleton anyway, right?
Toto sa javí byť
Normally
vysoko,
you
lebo
can
to
go
pod
in and
nejakou
often you have to sort of feel, without digging, you have to feel gently.
musíte jemne sa zanoriť bez toho, aby ste sa nejako veľmi vrtali.
Now, if they're this particular person, skeleton, you would think they're both high.
Tu by ste si povedali u tejto konkrétnej
It's a
kostry,
right.
že obe tie rebra sú
You
vysoké.
come in and often you put your fingers in and you go down to this and it's kind of soft and then you hit bone. But people who have first rib problems often you just put your hand on and they go, oh, it's painful.
Ale ľudia, u ktorých to rebro je vyššie a vy sa tam zanoríte, tak už to pre nich môže byť citlivé.
I'll be back. So the first thing you come on, are they level?
Čiže v prvom rade chceš zistiť, že či sú
Both
v
sides
jednej
are high,
línii.
but left side you can feel higher.
Na oboch
It's
stranách
kind of
vysoko,
as
ale na
simple
tej
as that.
ľavej strane bolo cítiť, že je proste
So
vyššie.
then you feel for the scalings.
Potom si môžeš napalpovať skalany,
Okay, check the scalings. Sternocleidomastoid as well.
sternocleidomastoideus.
Okay, and you can feel on an awful lot of people, especially if they do desk work, they're high. Normally, on that situation, if you ask them to take a deep breath in,
Zvyčajne, keď ich vyzveš potom, aby sa nadýchli,
if you don't feel the ribs straight away, when they breathe in,
ak
the
hneď
ribs will
necítiš tie
rise.
rebra, tak pri tom nádychu majú tendenciu
breathe in.
si zdvihnúť.
And if they're quite high and you resist,
A ak sú
breathe in.
vysoko a ty im budeš trošku odporovať,
are they getting any pins and needles or numbness?
ešte chceš zistiť, že či pri tom, ako odporuješ,
Is
či
it
nemajú
affecting
nejaké
the
brnenie do
neurovascular
prstov.
bundle?
Is it affecting?
The neurovascular
A
bundle?
či to ovplyvňuje teda nejaký ten neurovaskulárny zväzok.
Neurovascular brain. You could, obviously, if that was the case, you check the pulse and
Pozriete si puls, ak by to bol ten prípad.
bring the arm up, ask them to look this way, that way.
Zdvihnete ruku,
We'll come back to
vyzvete
that.
ich, aby sa pozreli na jednu na druhú stranu.
So back to there, where was we? Then because of that, you check the lower ribs.
A kvôli tomu, že si pozrieš aj tie dolné
to see
rebra
if we've got
a hľadaš ten mechanizmus rozvíjania.
a superior lateral movement.
Ten superiorno
So
laterálny
it's
pohyb.
that. And if these are tight, secondary muscles for respiration,
A ak sú tie sekundárne respiračné svaly
first rib
napäté,
raise, 9 times out of 10, there's restriction down here.
zvyčajne tuto je reštrikcia v tých dolných rebrách.
See, that's a good thing of a routine. You know I know where I was.
Toto je dobré na rutine, pretože viem, kde som skončil.
Okay. So there's also some restriction on the probably rhomboids, yeah. So
Vnímám tu tiež nejakú
medial border
reštrikciu na rhomboidoch.
of the scapula. You okay? And this side of the rib cage, strangely enough, well not strangely enough.
A táto strana hrudného koša je vlastne tiež krušia.
Quite restricted. Come to there, that trigger point.
Teraz ideme na ten trigger point.
Okay. Push out towards me with your arm.
Zatlač proti mne tvoju ruku.
Relax.
Uvoľni.
So you contact the trigger point, which is
Vyhmazate sa
an area of fibres within the belly of the muscle which are hypercontracted.
čo je oblasť vlákien brúška svalu, ktoré sú v hyperkontrakcii.
Ask the patient to push out towards me. Push
Vyzveme
out towards
pacienta, aby
me.
zatlačil proti nám.
The muscles contract, relax.
Svaly sa stiahnu.
On the contraction phase, sorry, push again. I maintain the pressure.
Ja udržiavam tlak počas tej
On
kontrakcie.
relaxation, I increase the pressure.
When do we increase the pressure?
Or when the patient relaxes.
Keď pacient
Push out towards me.
uvoľní, tak sa ešte zvýšim ten tlak.
Relax. You okay? Push again. And relax. Okay. Turn your head to the right, please.
Poprošla doprava.
Relax.
Uvoľní.
Turn to the right again.
Znova doprava.
Relax.
Uvoľní.
Just take a deep breath in
Nadýchni sa.
and out. Okay. Sorry. And out. And again. Take a deep breath in. And out. And again. And out. And again. So I'm just applying some inhibition to the first rib, but not any great pressure.
Čiže on sa snažím o inhibíciu toho prvého rebra, ale
Turn to the
nerobím
left.
veľký tlak. Poprošla doľava.
Relax.
Uvoľní.
Left again.
Znova doľava.
Relax.
Uvoľní.
And left again.
A znova doľava.
Relax.
Uvoľní.
Just going to side bend your head a little way.
Čiže
Take a deep breath in again.
Nadýchni sa znova zhlboka.
And out.
Vydýchni.
Just try to straighten your head. Just relax.
Snaž sa akby narovnať hlavu.
Neck. Straighten the neck.
Krk.
Relax.
Uvoľní.
And again, straighten the
A
neck.
znova.
Relax. Okay, come right onto your front, please.
Poď na vzduch.
Okay? Just let your arms drop in. Sorry, that's
3 seconds. Yeah.
It sounded like that was deliberate, didn't it? It's all right. It's all right. We're having a little private joke.
Oh, sorry.
Didn't mean to exclude you.
It happens.
It happens. You still okay? Don't forget to keep checking that the person is
Stále
okay.
spýtajte vášho pacienta, či je v poriadku.
We had, when I was a student in the European school,
Keď ja som bol študentom v
I
Európskej
don't know why I'm laughing because it's really not funny.
Neviem, prečo sa smiem, lebo to vlastne nie je smiešné. Nostalgia.
Actually, I think I was a tutor, not a student.
Myslím, že som bol vlastne vyučujúci, nie študent.
And I went into the waiting room and I said to the receptionist, there used to be quite a big reception, about 4 of them.
Mali sme tam veľkú recepciu, boli tam asi 4 počne.
I said, that man over there, he's been here a long time, hasn't he?
A hovoril som, že ten pán je tam nejako dlho, nie?
They said, oh yeah, he's waiting. I said, who's he waiting for? He said, oh, I don't know.
Ale na koho čaká?
He was dead. He had died in the waiting room. And he was waiting, well, he was waiting for his appointment, I think, but he died.
Like,
And the receptionist hadn't noticed. So
čiže ten pán, čo čakal na tej recepcii, tak on umrel a tie recepčné
So they had to put a screen round him, and it caused a bit of trouble, as you can imagine. But, thank goodness, he was dead before he had treatment.
Ale dobre je, že sa mu to nestalo pri ošetrení.
Every cloud has a silver lining. It would have been far worse if he'd have died after treatment. Imagine the trouble that would have caused.
Čo by sa stalo, keď bol po ošetrení? Alebo počas.
On our courses, we normally have like saying like you need to like pull the patient out and leave him like that he has legs like to the door, like he's coming in, like that he's going out.
So, yeah, coming.
Že máme také, že na našich kurzoch sme vždycky varujú, aby sme toho človeka potom vytiahli a nechali ho nohami akože dopredu, aby to vyzeralo, že išiel dovnútra, nie že ide vonka.
Dopleniť.
Yeah, the dentist jokes are also really black. Čiže také
Pull your
čierne.
heels to your button.
Pritiahni Petru.
Sorry, no, not lift.
Nohu.
Oh, that's it.
Akorát som sa chystal na pozdrav.
Relax.
Kúkam.
Už tam leží.
Relax.
Sa počkám, už len
And
buchnete.
again.
A kamerina nemám.
Relax. Are you okay with the ankle? I know the cracking.
Pohode s tým článkom.
And by the way, nobody was waiting for
Won't
him
do
at the
too much.
point, like, for appointment? Nobody was, like, looking for his patient?
I don't know the whole situation because it wasn't anything to do with my patient,
Okay.
but he was dead. Push up towards the ceiling, and they very quickly kind of hushed it all up. Relax. Push up. I could tell you something far worse. Well, not worse. Would it be worse than dead?
Ešte nám môže povedať nejakú ďalšiu, ešte horšiu príhodu, ak taká existuje.
A tutor, which is not supposed to do, used to treat his own patients in the clinic time, in the students' time.
Čiže učiteľ ošetroval svojich pacientov v čase, kedy mal na glase výučbu.
But he also often treated them in the lunch break.
A ešte ošetroval počas obedu.
And one of the receptionists heard a noise.
A jedna recepčná
Someone
počula
went, hello.
nejaký zvuk alebo
Is
nejaký...
there anybody there?
Tak sa pýtala, že halo, je tam niekto v tej miestnosti, kde už
And
si ošetroval.
he'd used dry needling,
A využíval suchú iglu.
gone off to see one of the students, forgot about the woman who was in the room with the needles in, and went to lunch.
A zabudol na pani, ktorá mala tie ihličky napíchané a išiel na obed.
But that is true.
A to sa stalo.
It wasn't me. You know when people say I know someone, it seriously
Nebol som
wasn't
to
me.
ja. Ja som sa ho pýtala totiž to, že či nikomu nechýbal na tom jeho termíne. Ten chlapík tam tak spokojne dlho sedel.
Ja som dával kartičku, když tam to pohľad.
Nerušil.
You okay?
Víš, potom za tabák.
Yeah. Because the ankle situation, you get pain in your ankles anyway. is cracking. How long's that cracking gone on for?
A ako dlho už máš to búchanie?
Forever.
Forever.
Odjak živa?
And it's all over, isn't it? So. Not marked ligament laxity, is it?
It's not.
She hasn't got marked, you know,
Nemá
not excessive ligament.
nejaké extrémne, nejakú extrémnu laxicitu väzov.
She just awkward. I think she's just awkward, just a joke. But she understands me. Okay. Push up towards the ceiling.
Zaplať tak stropu.
Now you may notice I've done all the techniques. Push up again.
Si všimnete, že som robil všetky tie techniky.
On both sides of the body.
Sorry, can you repeat that?
I haven't done all of the techniques that we did.
Takže nerobil úplne všetky techniky,
Push up.
ktoré sme robili.
Relax. I may have added in 1, 2 more.
Možno pridať jednu alebo dve ďalšie.
Okay. Pull the heels, you've got it.
Vytiahni perku zadku.
Relax. Pull up again.
Znova.
Relax. Pull up again.
A znova vytiahni.
Relax. You okay? Yeah. Come on to start facing this way.
It's
Is on the chair.
Is that enough? Is that okay? You need more, really. Sure.
Môžem si spýtať medzi tým?
No.
Či je pre mňa relevantné, keď ten pacient napríklad, že robí nejakú techniku a teraz on niečo robí a ja napríklad ako pacient cítim, že buď mi niekde začne brnieť prst, alebo že ma pichne niekde na úplne opačnom konci tela.
A sa to deje teraz?
No teraz nie, ale že sa to stalo počas toho treatmentu a že či je to informácia, ktorú by som ja toho pacienta chcela vedieť a či je to pre mňa relevantné.
So is it relevant if you are doing some kind of technique, let's say the lumbar, and the patient starts to have, let's say, the hand or some other pinching in different or peripheral area of the body at the same time? Is it something you should know about?
Yeah. Yeah,
No?
maybe.
Yeah, I can't remember now, but
Čiže nie je
or yesterday,
Push back.
2 days ago, like on Friday as well, with some technique.
Push back. Yeah.
With some technique on one part of the body, I felt like a needle on another part of the body.
Sort of what level though? Was it?
Like we were doing something here, and I
Yeah.
felt a needle
the others.
somewhere.
Ah,
If it's something that the patient should tell me,
yes. Yes,
And if I can read out
stay
an
there.
information.
Stay there. It depends where, because often you'll get, someone might come in with just low back pain,
Takže môže k vám prísť niekto, kto má len bolesť chrbta.
and you say to them,
Kriekovej chrbtice.
is it localised? Is it
Uh,
travelling?
Vy sa opýtate, že či je to lokalizovaná bolesť, alebo
Is it in the
či
buttocks,
putuje,
back of the legs? Do you have any pins and needles or none?
či vyžaruje niekam, alebo či máte nejaké brnenie, alebo pacient, či má nejaké brnenie.
And they will often say, not in my legs, but I get pins and needles in my hands.
A oni vám povedia, nie v nohe, ale niekedy mám brnenie v rukách.
Well, the easy way out of that is saying, well, that's a different nerve.
A vy môžete povedať, že OK, to je iný nerv.
But it could be linked in quite easily with what we were looking at with the three triangles
Môže to byť prepojené napríklad cez tie tri trojuholníky.
and the apex of the upper and the middle triangle meeting at T4.
A vlastne tie dve krivky sa spájajú v tej štvorke.
And there could be that it could be like T4 syndrome, which can give you pins and needles and in the hands and things.
Ktorý sa potom bude prejavovať práve tými brnením tých rúk.
Bring it forward to someone if you're treating them and it happens.
Čiže ak niekoho ošetrujete a stane sa to,
Then you take note of it
tak si to ešte poznačíte alebo proste
and check that other area.
a pozrite sa potom na tú oblasť.
Check the lower neck and the
Pozrite
T4
sa,
area.
na dolnú časť krčnej chrbtice a TH4,
To see if there is a correlation.
aby ste videli, či je tam nejaká korelácia.
Well, if we want to be really scientific, there's a correlation because they come on at the same time, but it doesn't mean that it's causative.
Keby sme chceli byť veľmi vedeckí, tak korelácia tam bude, lebo sa to stalo v súčasný čas, ako vy ste pracovali s tým spodkom. Ale nemusí tam byť kauzalita, čiže nemusí to byť priama príčina.
Because the correlation and cause can be completely different.
Pretože tá korelácia a príčina môžu byť úplne odlišná.
Strangely enough, we talk a lot about correlation. And
Zaujímavé, že veľa rozprávame o korelácii.
I was listening to a big debate with some scientists
Ale počúval som nejakému rozhovoru vedca
on BBC Radio 4.
na BBC
Radio 4 is where they have all that kind of talk.
a tam mávajú teda takéto rozpravy.
And there's the government in the UK, I think elsewhere, are trying to alter screen time for children. Well, for all of us really, they're trying to limit what can be watched and how long and
A
things.
vláda v Británii sa snaží, alebo by chcela redukovať
Access.
prístup keby obrazovkom alebo
they're actually
telefónom pre
trying to-
deti a v
They're trying to
podstate pre
make
dospelých.
laws.
They're
trying to make laws about under 16s, I think it is, and there's
Chcú vytvoriť nejaké zákony, ktoré by sa týkali detí do 16 rokov, ktoré by teda mali nejaký limitovaný prístup
and
k obrazovkám.
they're saying that the screen time affects them and all the problems. Basically, what the scientists are saying,
A v podstate, čo teda hovorí,
that the data they're using is
je, že dennodenné
Not correct.
používanie a s telefónom nie je úplne ideálna situácia.
they're not saying that too much screen time does you harm.
Netvrdia, že veľa toho času na telefóne vám ubližuje.
The scientists are saying the correlation they're using is incorrect. So the correlation,
Čiže vedci tvrdia, že tá korelácia
which doesn't apply, doesn't necessarily make it the cause.
neznamená hneď, že je to aj príčina tých problémov, čo máme pri
But
deťoch.
they point out, the
Ale
scientists,
vyzdvihujú vedci,
we don't disagree totally.
že úplne to
But what we're
nevylučujeme,
saying is your facts are wrong
ale len tvrdíme, že vaše fakty nie sú úplne správne,
and there is no
ale že
proof,
sú nesprávne
current proof,
a nie je žiadny dôkaz priamy,
that the screen time does you harm.
že tie obrazovky naozaj sú, alebo obrazovky,
And the,
čas pred obrazovkou, že reálne je nejaký problém, nejakú újmu.
the correlation they used to dispel it, so they used the correlation aspect to say it wasn't true.
využiť zase aspekt korelácie, že to nie je pravda.
And the example they used was,
A využili príklad,
there's a correlation between eating ice cream
že je korelácia medzi jedením zmrzliny
and skin cancer in the summer.
a rakovinou kože v lete.
Because more people get skin cancer in the summer,
Pretože samozrejme viacero ľudí získa
the more
rakovinu
people
kože
eat
v
ice
lete
cream.
a zároveň viac ľudí je zmrzlinu v lete.
But there is no causative factor
Ale nie je tam žiadny
that eating ice
kauzatívny
cream gives you
faktor,
cancer.
že by to proste navzájom súviselo.
So that's the kind of example they were using.
Čiže toto je príklad, ktorý využili.
So there is a correlation that you've got,
Existuje korelácia,
but it doesn't mean what you're doing is the cause.
ale neznamená to, že to, čo robíš s tým pacientom, že vyslovene je príčinou toho príjmenia napríklad.
But equally,
Ale zároveň,
if we go to some osteopathic principles
ak by
and
sme išli tým osteopatickým
we
princípom,
use, I've forgotten his name, Henry's lines,
využívame Henryho
three
línie
triangles,
a tie trojuholníky,
Little John mechanics,
trojzložilnú mechaniku,
Wernham.
Bernhamov prístup.
You can say that, yeah, T4 is an osteopathic centre.
Áno, môžeme povedať, že TH4 je
It's also
osteopatický centrum
associated with
vazov.
pins and needles and arm
A
symptoms.
tiež to môže byť spojené s nejakým brnením členstva.
So there can be a correlation
Takže tam môže byť korelácia.
because we know that that links around there, that triangle.
Pretože vieme, že ten
And that
trojuholník
triangle.
prechádza tým súvisom.
So maybe moving this.
Takže možno
Great.
týmto mi spôsobuje niečo aj tam vyššie.
Come back onto your back for a minute, please.
Poďme chrbát.
Takže je dobré povedať tomu pacientovi, že aby mi zdieľoval nejaké pocity, ktoré má pri
Should we
tom.
tell the patient he's supposed to share with us any of these symptoms?
Now you're
or-
looking suspicious now, aren't you? Pardon? Sorry?
Yeah, if we should inform the patient
Take a deep
that
breath
he's
in.
supposed to share with us
And out.
this information.
Okay.
Mhm.
Yes. Yes.
Áno.
Definitely. Definitely. Okay. So I just did a stills technique there, which we can go over again. But
Teraz využil spolu techniku.
I just slipped that in.
Trošku tam skôzol do toho.
But this is where I would, if I was going to HVT,
A napríklad, keby som robil
I would do my HVTs.
manipuláciu na svojom pacientovi,
She's quite hypermobile anyway in parts, but not everywhere. It's a
máme tu
bit
pomerne hypermobilného pacienta, ale nie
kind of
všetkých
this part
segmentov.
separate to that part.
Čiže táto časť je trošku iná ako tá druhá časť.
So she has quite a lot of mobility in her neck.
Má pomerne dosť mobility v krku,
Yet strangely enough, she has this going on,
ale
which
zároveň tu má toto stiahnutie,
is slightly confusing.
čo je trošku
Okay.
metice.
So I would probably adjust more if I was going to adjust in the thoracics, if it was the person who came in.
Keby bola teda človekom, ktorý ku mne prichádza, tak by som sa asi viac zameral na hrudnú chrbticu
And probably adjust in the lumbar spine.
a lumbalnú chrbticu v rámci nápravy.
But I might not as well. I might say, depending, you make a judgment on the person.
A zároveň si to musíte vlastne usúdiť na základe tej danej osoby. Čiže nemusíte to robiť
You might
manipuláciu.
leave it there. You don't have to do.
Môžete to proste uzavrieť len týmto.
But statistically,
A štatisticky,
well, I was ready to talk again in the UK. Statistically, people feel it's been more of a therapeutic effect if they hear the crack.
ľudia majú pocit, že to bolo
Cavitation.
viac terapeutické, ak počuli to puknutie.
Which, if anyone's worried that they're doing an HVT and they don't take it through,
Čiže ak máte pocit, ak sa niekto obáva, že robíte tú manuálku, tú manipuláciu, ale nepodarí sa vám to
I'll show you what I mean. Come onto your side towards me. I'm not going to do it. If you line someone up,
Ak si niekoho nastavíte
and say,
a poviete,
you have to ask permission first to do it, obviously.
najprv sa musíte
Is it
samozrejme
right,
opýtať na povolenie.
I take it for granted. And then you say, you may hear a little cracking noise, there's nothing to worry about.
A môžete ho upozorniť, že Môžete počuť nejaké puchnutie, nebojte sa toho.
A lot of them are waiting to hear that.
Veľa z nich čaká, že bude
Seen
počuť
it on
puchnutie, lebo to videli
YouTube.
na YouTube.
So you come into the position, and if you do a thrust and it
Pôjdete do
doesn't
pozície
cavitate,
a urobíte ten thrust, ale neurobí tú
you nicely say,
kavitáciu,
good, that's mobilised.
tak môžete povedať, ale super, tak to sme zmobilizovali.
I don't need to take that any further than that, it's already mobilised, it's
Už
moving.
nemusíme ďalej pracovať, už je to zmobilizované.
And you explain to the patient,
A vysvetlíte pacientovi,
you don't have to hear that noise, it's
že
called
nepotrebuje
cavitation,
počuť tú kavitáciu,
which is the gases, you know, it's
čo je vlastne ten
you
plyn a
don't
tak
need
ďalej.
to hear that for the therapeutic effect.
A
And in
nepotrebujete
reality,
na
you don't.
terapeutický efekt.
In reality, you don't. If you're doing your articulation and mobilisation.
A v skutočnosti to naozaj nepotrebujete.
But no doubt,
Mobilizácia a...
many people will want to hear it.
Ale veľa ľudí to bude očakávať.
Depends on what they come to see you for.
Závisí, že na základe čoho vás prišli
Because
navštíviť.
you get the opposite when people do not, I don't want any of that cracking.
A sú ľudia, ktorí vyslovene vám povedia, že nechcem žiadne
Which is
pochopenie. Čo je v
It's-
poriadku.
It's fine as well. It's not for us to impose our will, is it?
Nie je na nás, aby sme my si nejako presadzovali naše predstavy. To má terapia vyzerať.
Okay. Push your knees apart,
Zatlač tvojimi kolenami od seba.
relax. There you go. Push apart,
Zatlač.
relax. Push apart, yeah,
Zase zatlač.
relax. Push together,
Zatlač k sebe.
push it down,
Zatlač k sebe.
relax, and push it down. Relax. I would probably do that if they came in
Toto by som
with
robil
the
napríklad,
hip and low back pain.
keby prišli s bolesťou drieku a bolesťou bedier.
Okay, so there we kind of have quite a few techniques.
Takže máme zo pár
Probably time to
techník.
take a break.
Asi je čas dať
Okay,
pauzu.
you all right?
Si to je.